everybody. Well, let's go ahead and get started. Welcome to today's workshop. Today, we're doing an end of the year Janet Features wrap up and also talking about what's next in 2025. This year has been really exciting. And part of why I wanted to do this wrap up for everyone was that we've had so many different things we've added to Janet and things that we've been doing this year. That I know it's even hard for me to keep track of it all. So I know if you're out there doing other things and busy, you might have missed some things. So I'm excited to have this opportunity to kind of go through all the things we've been doing and giving you an update on what's possible for you, and also hear your ideas, because I would love to know, as we've continued to grow, there's more and more of you who are working with us or who are part of our world somehow, and all of you have great ideas too. So I'm excited to hear them. So where are you in the world? Yes. Please go to the chat. Let us know where you're joining us from. I see lots of people from all over the country in the chat. Y'all, that's so wonderful. This is kind of like a dream come true to have so many of you all here today. I might get a little emotional about it, but I'm here in Portland, Oregon, where the sun just decided not to be out anymore, which is very typical. But I can still see some blue sky, which is very exciting. These are some pictures. Last night, I was very happy, and this was the weather last night at my house, and I was very excited to be able to have some Christmas lights put up right in time for a big windstorm, but luckily they did not get knocked down, so I'm very excited about that. I'm Ginger Bandine. I'm the founder and CEO at Mission Driven Data. I think there's some folks here I might have never met before, so it's very nice to see you. I grew up here in Oregon. I'm from a small town. I'm a social worker. I started Mission Driven Data about 5 years ago. Soon I'm going to have to say more than 5 years, but the whole goal of our company is to make life better for the agencies that are out there serving folks in the community. And I started off as a social worker doing direct practice, and then moved into quality improvement and compliance, and then started doing data stuff. And I felt like we needed more people doing data who understood the clinical and quality side of things. So that's really the sort of heart of our company, as we try to think about the folks who are doing services and the people they serve, and try to make life better for those folks so that they can serve people more effectively and ultimately improve the quality of life for the people we all serve. And my passion is thinking about data in terms of like the big picture. So you'll see some of the things we've been doing this year were related to, some kind of operational stuff, some cool tools you can use now. But also we're always kind of setting our sights on, what are the bigger things happening in behavioral health, and how can we help move the needle on some of the things we think are important. So, and again, it's great to see you all here. Thanks to everybody. So real quick about Mission Driven Data, like I mentioned, we've been in business about 5 years. We support over 60 agencies across the country now. We've been growing every year. We're in many, many states. We have a data tool that makes it easier to get your data out of Credible. It's called Janet. We have a community where we offer training and support and guest speakers and all kinds of things. That's free. Everyone can join. We're going to put a link in the chat, so if you aren't already a member of our community, you can join us. And then we have consulting services. So we have a team of people who are mostly kind of like me, people who worked in community mental health, behavioral health, who have a passion for this work, and who now really enjoy helping agencies leverage their data to get better information and to make better decisions. Okay, you are in the right place today if you're a leader at an organization and you're looking to expand your capacity, improve outcomes, make the world a better place. We're happy that you're here. If you're here and you already use Janet and you want to know more about what Janet does, then you're very welcome. If you don't use Janet, but you're thinking about using Janet in the future, you're of course also welcome. And if you've never heard of Janet and we're going to be talking about it and you're worried you'll be confused, don't panic. Janet is just a program that makes it easier to get data out of the Credible EHR. But a lot of the tools we're talking about will make sense. They're just like things that we're doing that make life easier for your team and hopefully for the clients you serve. So don't panic if you've never heard of Janet. I'll explain it a little bit, but you don't really need to know more than just like, it's a magical thing that gets your data out of Credible. And also, we're happy if you're here too, because we hope you want to give your input to us about what we should do in the coming year and other things we should build to make Janet even better. Okay, here's our agenda for today. We're going to talk about the new features of Janet and how folks are using those features to improve services. We're going to talk about events and opportunities to engage with our team. And then we're going to talk about what's coming in 2025. So pretty fun stuff. Oh yeah, today's session is being recorded, and I know for sure because I remembered to hit record. This is partly why the slide is here. So we're recording today, so don't panic. You don't have to furiously take notes. We're happy to share the slides after our session today too. If you want to make sure we send you the slides, you're welcome to put that in the chat so our team sees it. Please ask questions as we go. I know we're going to be covering a lot of information. If there's a question I can't answer right away, I will just let you know. I'll get back to you. But please ask. We want to know what you're curious about. And like I said, there'll be some kind of handout after our webinar too. Okay, I always like to start things off with a quick poll. I'd just like to know a little bit more about who else here. And y'all, there are a lot of you here, which is amazing. Thanks for being here. I would love to know, how have you engaged with us this year? And if today's your first time, then that's totally fine. You can just say attended a webinar. But there's a lot of things we've done with folks this year, and we would love to know which of those you have done this year with us. And then we're also curious, what Janet features did you try out this year? There's a whole bunch of things listed there, and it's okay if you're not sure, but it would be great to know what you guys, who else here, what things you've participated in, what things you have tried out. All of that is super helpful. So thanks everybody for filling out the poll. And if you're not sure about what extra things in Janet you've used, that's totally fine too. We just would love to know who else here and what things you're using. So great. It looks like a lot of you who are here have attended a webinar this year, meaning probably today. So thank you. Looks like quite a few of you are also using Janet or have at least had our data snapshot. Some of y'all have worked with one of our solutions consultants. Some folks are on our CCBHC email listserv. Some of you have come to co-working. Some of you are doing whole person outcomes. There's some folks here who have come to some of our in-person events, which is awesome. And then there's, looks like people are using all different things in terms of things they use with Janet, but yeah. And I'm gonna pop over and see if there's anything in the chat anyone added. Okay, thanks everybody. It's just nice to know who all's here and what you guys have participated in so that I know how to speak to that. So I'm gonna go ahead and end the poll. So as I mentioned, we're talking about a bunch of features that were added to Janet, and I just wanted to explain that Janet is just a name of a software program where we use that program to gather information from different systems. So that could be your EHR. We specialize right now in Credible. We've explored doing CareLogic. If you are a CareLogic agency and you would be interested in exploring that with us, let us know because we are looking for people who would be interested in that. Different types of forms that we can get data out of, other external data sources, other operational data sources, and whole person outcomes, which we'll talk a little bit more about. So Janet is just a program that takes all that data and with that data turns it into data tools and also different like automations and things like that that make life easier for folks at your agency and hopefully improve the lives of the clients that you serve. So we can do things like helping people get appointment reminders. We'll talk more about that. Special types of alerts, but all different kinds of things. But if you just think about Janet as sort of like this processing thing that is in between gathering the data and then doing something with it, that's kind of how to think about Janet. So our favorite thing that we rolled out this year, or my favorite thing, I don't know if it's everyone's, but we rolled out a new program called Whole Person Outcomes, which is where if you're working with us and using Janet, then included in Janet is the opportunity to send your client surveys. And I mean the clients you serve surveys by text message, and we help you set that all up. We have a HIPAA compliant way of collecting that data and then combining that data so that it matches up with their record in the Credible EHR so that you can see like a list of everyone on your caseload and how they've answered the WHO5 Wellbeing Index. The WHO5 Wellbeing Index is a free outcome measure out there. It's used very much internationally. It's validated for adolescents and adults. And it's really nice because it's strength-based and it just asks people 5 questions about how they're doing. You can see the 5 statements here. They're really nice and, the kind of things you would ask a friend, if you were wondering how they were doing. So we really like it, and we've had an amazing set of results from it. So far, as of yesterday, we've collected over 8,000 responses to the WHO-5. We have about a 21% response rate. There's 8 agencies participating across, I think it will be 10 states. There's 2 states pending, so we'll have 10 states participating by January. If you are an agency who's interested in doing this, we would love to get you set up with it. Our team is very thrilled to be doing this, and it feels, I'll talk more about, there's another slide here, but you get a set of reports that show you how people are doing. The other thing that we can combine that with is custom alerts. So imagine you're sending out these surveys to your clients, you're getting their results back, you're able to match that up. People are using that to demonstrate outcomes. They're using that to see if people are struggling or doing better. But one of the cool things with whole person outcomes is using it in combination with custom alerts. So custom alerts is a special thing we've built into Janet that's also included, where if something is going on with anything incredible or any other data that we get information from, so in this case, whole person outcomes, we can set up an email alert to go to whatever staff you want to receive that alert for all kinds of things. So this works out really well with whole person outcomes. So we have agencies now where if a client scores below the threshold for a concerning score on the WHO-5 Wellbeing Index, we can generate an alert email that goes to that client's case manager, to their primary therapist, to a care coordinator, and that can happen the next morning. So as people fill out the survey at night, the next morning, there's an alert for whoever needs to see that someone, is struggling. And we've already received feedback from agencies where care coordinators have followed up on those and found that the client was wanting to re-engage, but just didn't know how. And so we've seen amazing outcomes like that, where we noticed right away when we sent out the first round of whole person outcomes that a lot of the people answering the survey had recently no-showed to an appointment. So we really did have this sense that maybe that people needed another way of receiving some kind of care and some kind of reach out from the agencies they were getting services from. And so that filling in that gap is part of what is so exciting about whole person outcomes. So if you think about it, someone who no-shows to their appointment, but then they get a text thing to fill out a survey and they answer it, that's sort of a little bit of a sign that they still want some kind of help, right? And so if there's a way then that there's some feedback from that where they get a phone call from someone, I think that's just a really nice wraparound approach to care. So anyway, I really love whole person outcomes, as you can tell. Custom alerts, though, have way more implications than just whole person outcomes. If you have other screening tools you do in your system, like a PHQ-9 or a GAD-7, or you want to know if maybe you have clients who receive services from a medical provider and a case manager and a therapist, and all 3 of them want to know if someone no-shows to their appointment, you can set up alerts like that. There are alerts built into the Credible EHR, but they usually don't work quite as specifically as agencies want. Another example of custom alerts would be a lot of agencies use them for things like human resource things. So if there's maybe a new staff who comes in and has a new account in one system, maybe you send an alert to other people to let them know they also need an account in another system. So there's all kinds of things you can do. I think there's a lot of applications for custom alerts with a lot of the value-based payment things where, you want to let people know that someone qualifies for some kind of screening they need to have done or need some kind of follow-up. Anyway, we love custom alerts too. So whole person outcomes, custom alerts. Another cool thing that we started doing this year with Janet is getting data from Point Click Care, which is a health information exchange that's used in several states to notify community agencies when folks they serve are in the emergency room or have been to the emergency room or have ended up in a hospital setting. So we have figured out how to get the data from there and combine it with your Credible data and give you reports that can show you how people are doing, how are you doing with helping people stay out of the hospital, how are you doing with following up with people who've been in the hospital. This ties back really nicely with custom alerts so that theoretically, if you had data coming out of Point Click Care that showed someone needed some kind of follow-up, you could have that generate an alert to the staff who need to do that follow-up. So we love this aspect too. And you'll notice I started off with a lot of features that we've added to Janet that are really designed, you can kind of tell with like my clinical heart in mind, like how do we make life better for the clients who are being served at the agencies we serve? And so I think it's one of the ways that we don't always think about data as a clinical tool, but these are ways that I think it's really clear that data can be a clinical tool. So, oh, there's a great question in the chat that I'm going to answer, I promise. It's about our relationship with Qualifax, and I have a slide about that, so stay tuned. But to answer your question quickly, we have a very positive relationship with Qualifax, who owns Credible, the EHR we support, but we are an independent company, and we do not have any contractual relationship with them. So I'll tell you more about that later, though, because it's been a great year for building relationships. Yeah, okay. So just more integrations that we've added to Janet. So when we first built Janet, Janet was just a way to get your data out of Credible. And what we realized pretty soon was agencies have data in lots of systems, not just in Credible, even if they use Credible for their EHR. So we've worked hard to start building in ways to pull data out of these other systems and then combine it into dashboards that include maybe your Credible data and maybe Paycom or Paylocity data so that you can see like your cost per position and your revenue per position. There's a good question about where we're getting ED information. That's a system that's a health information exchange in several states where community agencies have access to pull data from those HIEs that is related to the clients they serve. So that's how we're getting that data. It's related to, there's a relationship between the agency and Point Click Care. And sometimes they have an intermediary, like a hospital association buys the license from Point Click Care and delegates it to the community agency. But that's how that's working. We're working in, there's at least 4 states I know of who do some relationship there. And just if you're curious, I can tell you it's Oregon, Washington, I think California, now that I say that out loud, Oregon, Washington, Minnesota's just starting, and Virginia. Those are the ones I know of, but I think they're in more places. Okay, so talking more about integrations, other things we can integrate data from Paycom, Paylocity, Sage Accounting, Smartsheets, Azure Active Directory, Microsoft Forms, SurveyMonkey, and even just like a CSV file or an Excel file, we figured out a way to automate that too. So all these different places you might have data, we can help you get that data out of those systems and into data tools. Most agencies who use Janet are using Microsoft Power BI for their data tools. And that's the one we have lots of reports built in. So so agencies who are using this are getting all kinds of cool benefits from that. I would say the Azure one tends to be things like compliance. So, there's like, how when someone leaves, there's like 10 things you got to remember to do. And it's very, we're human. We usually remember about 8 of the 10. So having some of those integrations means you can see like, hey, this person's job title changed, or this person's, access changed to this thing. Should we also change their access in Credible? Should we also change, their access to other systems that have PHI in it? So I think there's some really nice benefits there. SurveyMonkey, people are doing other kinds of surveys and combining that data like satisfaction surveys. I'm trying to think. Accounting software, sometimes it's just nice to see, like, I know a lot of agencies now are trying to kind of wrestle with what amount of money still sitting in Credible is actually going to be payable. Like, how much are they actually going to collect of what's sitting out there? And so there's some nice ways to do that with some of the reports we've built and then combining it with your accounting stuff. We did a whole session on this year. And if you're curious, the recording is in our community, but we worked hard to set up what's called row-level security in Power BI. So I mentioned Janet helps you take data from places and put data in places. And like I said, most agencies that we work with use Microsoft Power BI to display data, to analyze data. And Microsoft Power BI has a feature called row-level security. We have figured out how to mimic the security in Credible in your row-level security. So if you have a report that you want to put in Power BI and you want to make sure that the people who access that report see the same set of clients they would be able to see in Credible, we have ways to set that up so that will work that way, which is really nice. Oh, yes. Will this meeting be in the community? Yes, we're recording this. It'll be in the community. Yes, for sure. Appointment reminders. So this is a feature we added this year. A lot of it has to do with things we just heard people were struggling with. So there are some built-in appointment reminder features in Credible, but people were struggling to get those to work the way they wanted. They wanted more transparency. So we built out a way to send text message reminders about appointments to your clients on the schedule you prefer. You can review the messages that were sent in a Power BI dashboard. We've continued to work with the agencies who are doing this to, spiff this up and make it work the way that works best for them. But that's also just included in Janet. So for some agencies, that's like a little bit of a cost savings if you're paying extra to some other system to send your appointment reminders. And the nice thing is then it's all in one place. So that's something we can do. And then there's more automations. By the way, this is a picture of candy making. For some reason, my social media feed is full of these candy machines. I don't know what it's trying to say to me, making taffy. But automations that we try to think of are things that would make life better for your staff and your clients. So we have a thing now called the Janet Data Gateway, which is a way to securely transmit data back and forth to us. If you have some data that's living somewhere else on your internal systems and you want that to combine up with your Credible data, we have ways to help you get that set up. We have developed some basic reports that are really helpful if there is an event where Credible is out and you need to see like your clients and their contact information and maybe their upcoming appointments and their medications. We've been working on those with some agencies and can make those available to the folks who have Janet as well. We also have a way, if you want to do HIPAA compliant surveys, our SurveyMonkey account allows us to host your surveys as well. So just another thing you can get from working with us, if that's something that would be helpful. Basically, we're trying to solve some of these technical problems for you all so that it's not everybody out there reinventing the wheel, because we just don't think that's very effective. And we want you to spend time doing the things you care about, like helping the clients you serve. So if you have things like this that you like, it's too bad you guys couldn't handle this thing. Those are the kind of ideas we're always looking for. So let us know. And then this is another really exciting thing we're working on. We are a partner in the state of Kansas. We are working with multiple Credible agencies who are part of a big data warehouse project. So NetSmart has this product that is a data warehouse that combines data from across agencies, specifically related to CCBHCs. We are helping build the connection from Credible to that data warehouse. And we are actually Qualifax's preferred solution for that. So when someone asked earlier, what's our relationship with Qualifax? We do not have a formal contractual relationship with them, but they like us and they say we are their preferred solution for Kansas's data warehouse project. So we are very excited about that. We're very excited about this project. We are very committed to making sure it goes well. Yeah, that's been a big step for us. We're using all of our experience with Credible and writing reports in Credible to help agencies as quickly as possible be able to get their data to NetSmart so that they can use that for advocacy with their state legislature. But the bigger picture for this data warehouse project is that multiple states are adopting this. So if you are in a state that is starting to talk about this NetSmart data warehouse project and you use Credible, let us know, because we are building a solution that we think will work in other states as well. So we're working with NetSmart to kind of be in the loop on that. But if you know about that already in your state, let us know, because we want to, the sooner we can get started on those projects, the better. Sometimes when there's not as much notice, it's harder, but we will do our best to make sure we can get things over the finish line regardless. Which brings me to generally CCBHC data and reporting. So in case anyone's on the call who's never heard of a CCBHC, it's a certified community behavioral health clinic. We're going to do a whole session on CCBHCs again this year, because there are multiple flavors of CCBHCs, and the whole idea of it was to make things more uniform, and also uniformity is not really our strong suit in behavioral health, and also maybe not always what's best for our communities. So it's evolved over time, but most agencies who become a CCBHC have a bunch of data and reporting needs that are complicated, that involve a lot of manual stuff if they don't have a report writer, and just are very time consuming. And over the last few years, we've helped a lot of agencies with those reports. And we've just realized that there has to be a better way to do this. So recently, we've started working on some standardized data model things that will make it easier for us to adopt CCBHC reports for the agencies that need them. So we've developed some best practices around how to collect data. And we're in the this is kind of coming in 2025 still, but we are in the in the starting phase of like building out a set of data sets that can be plugged into regardless of how you have your EHR set up. So that sounds more complicated than it really is. Basically, like CCBHC reporting requires several standard metrics. And we're going to set things up so that once you tell us how you measure those things, it's pretty easy for us to get those things translated into the kind of report you need. So we're working on that right now. We also are going to offer, and we offer this now, if you need help setting up your billing matrix as part of the changes for CCBHCs, that's something we can help with now. And if you need help with any of these things, we're already able to help. I'm just saying we're working on making that even more streamlined and even more efficient because it's obviously like the number of CCBHCs in the country has just continued to grow, and it appears to be the way that funding is streaming to a lot of organizations, and we want to support you with that. So yeah, we're really excited about that step, which is part of another bigger project, which is in general, we've just started to realize that there's a lot of overlap in the different things you all do and the different types of data you all need. And so we are starting to build out more of a data model that lets us do way more like plug and play stuff for you and your agency. So we're calling that right now, those are called Janet Certified Tables, that data model. We may change the name at some point, but that's today's name. But basically the idea is that, when you get the data out of an EHR or any system, it's organized well for how to enter that data, but it's not organized well for how you might want to report on that data. And so we're working on building out a set of tables and a data model that is already optimized for how you would want to do reporting. So basic things like when you look at services, you usually want to know like what age was the client on the date of their service. So our team, we've done that calculation a million times across many, many reports. And we just want to build those kind of calculations into a bigger data model that we can use when we're helping you, but that you potentially could also use yourself when you're writing some of your own reports. So we're in the process of building that out. Actually, we started on that a while ago, but as we've been doing these other projects, that's helping us expand that data model. And it's just really going to make life better for everybody who needs data out of their systems. And we're using a lot of our experience with CCBHC reporting and even this data warehouse project to kind of picture how that's all going to look. So one of our sessions in the coming year will be about this. So don't panic if it doesn't quite make sense yet, but just know that we're working on making reporting easier and more efficient so that we can all spend time on the things that matter more than like, doing the same math over and over again. All right. So that is sort of what's new with Janet and what's coming up with Janet. We also had tons of events this year, and I wanted to mention a few. There's a great recording of empowering Janet users in our community. That was a great session if you use Janet, because we went through, it's actually probably useful if you use Power BI for anything, because we basically went through all the different ways we've seen people run into glitches with Power BI and what you can do to troubleshoot those. So it's a great tool. It's kind of funny because as soon as we did that session, literally people on our team were referencing some of the tricks. In fact, at some point, someone quoted it back to me like, "Hey, Ginger, did you try refreshing your browser?" So it's very cute. So that session is great, and I recommend checking it out. We also did several CCBHC roundtables, which were great because we walked through the quality metrics in those sessions and answered questions and talked through how workflows would work. And the outcome of that session was a CCBHC listserv. If you are not part of that and you're interested, let us know in the chat. We can send you a link, and we'll try to include that in the what we send out from today's webinar too. And then the other thing we offered this year was something called EHR Admin Essentials, which is a class that you can sign up for as an agency. It's specifically designed for Credible users. And it's basically a way to train more people on your team to know how the back end of Credible works so that they can help when you need someone to help. So it's a great way to build out like a deeper bench of people who know how Credible works. And it's a great orientation for people who are new to like kind of managing Credible. And we had great feedback about that. We offered, I think we offered 2 or 3 sessions this year of that, and we'll probably offer another session in the coming year. So if you're interested in that, keep an eye out for this coming one in the new year. Okay. The other very fun thing that I got to do, and some of the team also got to do this year, was we were at a lot of live events this year. I think, we're kind of finally out of like the post-COVID days. We were so lucky to get to host some live events. So some of these are pictures from events we sponsored or hosted. Nicole and I were lucky enough to get to go to NatCon in St. Louis. I got to present at the Florida Behavioral Health Conference with Paige Hudson, who's one of the people who uses Janet in Florida. We had a booth at the Virginia Association of Community Services Boards and also hosted a little reception that ended up being a lot of food. If we're ever hosting an event and you have the opportunity to come, bring to-go boxes, because I'm notoriously bad about ordering way more food than we need. So I think we could have all eaten for like a year off of the food from our event. So anyway, those were really fun. And it's, I think in our like Zoom world, it's easy to feel like disconnected. And I really still believe in person. I still kind of believe that like seeing humans in person is good for the world and good for us. So we'll continue to be doing things like that. Because I care about it. You'll see it on the far right here. I want to mention this conference. I went to this event called the Alignment for Progress Conference in DC this year. And that was all, it was sponsored by the Kennedy Center. And it was all about the national movements going on to try to expand access and improve outcomes in behavioral health. The Kennedy Center is doing this big push to advocate for different policies. And they had a whole data committee as part of that. I've been working on trying to get hooked into that so that I can be knowledgeable about what's happening, and also hopefully maybe give them some input on, what would actually work in real life. Because I think sometimes on a national level, the data initiatives are based on, I'm not sure there's someone in the room who can say like, hey, but let's talk about something that's actually like reasonable we could accomplish. So maybe not thousands of rows of, thousands of columns of data, but like, even if we had a couple hundred columns of data, we'd have a much better picture of what's going on across the country than we do now. So I'm trying to kind of figure out how to weasel my way into those conversations, because I think someone who understands things from a more ground level perspective needs to be involved if we're going to get where we want to go. So if you know of any of those kind of conversations happening, even like at your state, please keep me in mind, because I want to be involved in those things. Okay, other things we hosted. I also we were at the Kansas Association of Community Mental Health Centers conference. I got to co-present with the folks from Berks Counseling with Bonnie at the RCPA conference in Pennsylvania. And then we did 2 really cool, three different, well, this year we've done 2. We've started hosting our own live events. So in March last year, we hosted an in-person like Credible user group for the Oregon and Washington Credible users. The rumor has it that Qualifax is now hosting their own, but for a while there, they weren't doing in-person events, and we really believe they should keep happening. So we were just hosting them ourselves. So we got to host one here in Vancouver, Washington in the spring. And then we hosted, Qualifax did host an in-person event in Minnesota, and then we just hosted like a happy hour afterwards. So if there's something in your state where you're all getting together and you would like us to come buy you lunch, or have a little happy hour, or host an extra half day to talk about data, those are things we are excited to do. So let us know. That is something we would like to do more of, because again, I believe in in-person stuff, and I really like being out there and seeing you all in person. While I was in Minnesota, and Kansas actually this year, I got to go visit some of the sites of the agencies we support, and that, I'm a social worker. That made my heart really happy. So yeah, I love doing that. And I think that is part of what makes our company special, is that we really are still like real people who care about y'all. So that's not going to stop happening with us. Oh, and then I also got to do a presentation in Washington with the folks from King County, where we talked about hospital data and how to use that more effectively, which was really fun. So as I mentioned, we are planning out next year's events and conferences. And hey, what conferences are you all going to? Can you all put in the chat if there's a conference you're going to be at this year that you think we should come to? So far, I know we're probably going to attend the NatCon conference in May in Philadelphia. There's a couple of us that'll be there. But yeah, what conferences are you going to? What events are you going to? Where should we come find you? We would love to know. And then there's just been a lot of other really cool things happening with our team. So I want to make sure I mention that you may have noticed some new names in your emails from us, but we have a couple people who have new titles. Crystal Vega is now our strategic projects manager, and Nicole Morris is now our director of professional services. But we also have 3 and more coming team members who are new. Mike McRae is our new director of engagement. Mike has a ton of experience in behavioral health and also EHR stuff. He's worked with users who use different EHRs across the country. So you may have seen his name at his former employer. Alita Timpson is a solutions consultant for us. She's out of the Philly area. Alita is awesome and also came from an agency and has a ton of knowledge and experience with healthcare. And we're really grateful to have her here. And Katie Picosa is an intern and also working for us part-time. She's our project coordinator. Katie is a wizard at finding the answers to questions and keeping us organized. So we really appreciate Katie too. And there's 2 or 3 more people that I just can't put on a slide yet that will be joining us in the next few months. So it's a very exciting time. Okay, so we have some events coming up that I want to let you all know about. And then start thinking right now, and I'd love it if you put in the chat if you can think of topics you would like to see. We have a poll question here at the end too I'm going to ask you guys. But one event we have planned in February is about coaching and staff development techniques using dashboards. So we're going to highlight some best practices from an agency we've been supporting where they're really using data in like supervision and staff coaching, and it's really cool. And I'm excited for them to share their experience and how that's going. And you guys have a chance to ask them questions. I think it's going to be great. We're also going to try something kind of new and different in February where we are bringing in a guest speaker who recently wrote a book, and we're going to try out having like an initial conversation with Dr. Elena Schlotzka. I'm going to mispronounce her name, Schlotzka. So she wrote a book called Measurement and Evaluation on a Shoestring. So we're going to have an initial conversation with Dr. Elena, and then we have several copies of her book. So if you are one of, we'll post more information about this, but for folks who sign up, we will be able to send you a copy of her book. And then we'll have like a second session with her where we will like go over the book and be able to ask her questions. So she offered to do that for us, and we're really excited about that. So it's kind of like a mini book club for mission-driven data, and it's kind of an experiment. So we're excited to see how that goes. If you are interested in presenting, I know there's a couple people on the call that I've already hit up for possible presentations this year, but if you've seen something or heard something, or you know of something cool that's being done with data or just in general in behavioral health, we would love to highlight that. If you don't know this already about me, I kind of think that's how change happens in our system, is we find good things and then we try to highlight those and promote those. So yeah, keep that in mind. Let us know if you know someone or you would be interested in talking. Okay, so I want to ask you some more questions to get some feedback about this stuff. Okay, you should see a poll here in a second. Okay. So I know I covered a lot of information and I was excited. So I know that the danger when I'm excited is that I talk really fast, and there was a lot to cover today. So, But I would love to know, of the things I mentioned, which of these things are things you might want to try out in 2025? And of course, this isn't like a commitment. I would just like to know, like, which of these sounded cool, which sounded interesting, what are you kind of thinking about? And then this one's really helpful. What topics would you be interested in learning about next year? So those of you who are new to our sessions, we often offer sessions that are very educational, that just kind of, oh, there's no way to select multiple. If you still want to select multiple and it's not letting you, just put the extra ones in the chat, maybe. The ones you weren't able to select. Sorry about that, guys. Yeah, that's mean. You have to pick one. I promise we'll do more than one. Yeah, so if you wanna answer that, put more in the chat if you want to say more, please. And also we'll send this out and we can get more information. But okay, so here are some ideas for topics in the coming year, and I'm very interested, and I realize you can only select one. So if there's more that you wanted to pick but you couldn't, just type them into the chat for us. Okay, SQL tricks. Do people want more about SQL? Do people want more about common tables? Do they want more about using data in workflows? Measurement-informed care, which is a whole thing. Whole person outcomes is kind of measurement-informed care, but we've thought about like, how could we incorporate more learning around that? More about analyzing gaps in services, tools for staff retention. Some people have expressed an interest in like basic like statistical analysis, like think back to like your grad school class on statistics, but now knowing what you know now about what you might really want to know about statistical things. Janet certified tables, more features in Power BI, CCBHC reporting, and advocacy using data or something else. So yes, please pop more into the chat if you can't answer all of them. Sorry about that, guys. Yeah, and maybe what we'll do, Crystal, since we didn't have this be multiple choice, maybe we can just do a quick survey out with the slides that people can fill out too, if you just want to give us more feedback. I think that would be cool. Maybe we'll do that. Oh, that's so cute. Thanks, Rob. I love how you listed almost all of them. We could have numbered them. That would have made life easier. Oh, sorry about that, guys. I had my scroll bar. Okay, cool. Well, it's really exciting that so many of you are excited about these topics. If you think of things too after today, let us know. Because like I said, we like these events to be very, like normally, I know today we ended up talking a lot about Janet and lots of features, but we also like to offer sessions that are just like educational, like let's learn about this thing. So if you think of things like that, let us know. Okay, I'm going to end the poll. Okay. So just a reminder about our community, if you're not already in there, please sign up. It's free. There's no obligation. It's just a way to stay up to date and find all the recordings of previous sessions we've done. It's a great way. There's about, I think that we're up to like 400 or 500 people in there now. It's a huge group of folks, not just credible users, people from all over the country who just want to think and use data differently. So upcoming events, we have co-working tomorrow. If you're not familiar with co-working, twice a month, someone from our team basically just hops on a Zoom call, and anyone who wants to join can come. And they really vary depending on who shows up. Sometimes someone will be there who's like, I don't know, I just wanted to like check out what you guys do. And so maybe we'll like build a Power BI report together with some sample data. Or maybe they have a report they're stuck on and they want some help, and we'll write some SQL together. It's kind of first come, first serve, but we've never run out of time. So if you have something you're stuck on with reporting or data, or you just have a question about Credible or workflows, then just pop into the co-working and ask. You're most likely going to get your question answered. And you'll meet some other people who are also working on similar things. Crystal just popped the link to the community into the chat. So if you're having any trouble with that, let me know, but that should let you join. But yeah, come to co-working. So we'll have 2 sessions. We usually try to do 2 sessions a month. The 2 sessions for January are already there if you want to put them on your calendar. And there's all kinds of things in there that are just available for free, like SQL training, Power BI training, all kinds of stuff. So I encourage you to check it out. And just a reminder about Janet and how awesome Janet is. We love to brag about Janet because Janet's amazing. But if you are interested in using Janet, the one thing that I'm not sure everyone's aware of now is that we do a thing called a data snapshot now with Janet, where even if you're not sure yet if you want to work with us or use Janet, We can set it up where we sign a HIPAA agreement with you, with your agency, and for free, we will show you a sample of your data in our reports in Power BI. And what we found by doing that is that even agencies who don't end up working with us get so much out of seeing what's possible with your data. And it makes so much more sense when it's your data. So we set up a secure area where you can actually log in and see your own data in some really nice reports. And if that's something that you would be interested in doing, like I said, it's free. We'll walk you through your data, and it's a really fun way to like get more familiar with what's possible with data. So let us know you're interested in like having a data snapshot, and we will get that set up for you. Also, we do specialized consulting services. Our team for consultants has also expanded even beyond who was on that slide. We're trying to add in more people who can help with just basic, not like totally basic, but like a little bit of IT flavored help in case you're having trouble like getting Power BI set up for your agency, or you want to do something but you can't get into your Microsoft account or things like that. Yeah, let us know if that's something we can help with. Oh, and thanks, Rob. That's very sweet. Oh, yes. So our mission. So in case you haven't been able to tell from all the different things we do, we really just believe that every agency should have access to meaningful, understandable data to support you in your mission. The reason we're called mission-driven data is we think your mission should drive the data that you get to see, and not your data driving your mission. And so we really believe in that. And all of the things we do, we try to have that perspective on what we're doing. So we really think that we can help change the world if we give you guys the tools you all need to improve the services you provide, especially to highlight best practices and amplify those best practices to demonstrate the impact you have on your communities. Also to cultivate you as emerging leaders so that people like you become the people who are making the decisions, and eventually potentially like help define what counts as a good outcome in our system. Because right now, we're defining it based on some very narrow things related to PHQ-9s and GAD-7s. And having been a community-based case manager, I know that what we do to help people goes way beyond those measures. So I'm really always excited about new ways to think about outcomes related to the things we're actually good at in community services. So that's why we do all the things we do. That's why we have a lot of free trainings and try to bring people into our world and help you out. If you have any questions, you're very welcome to reach out to me directly. If you haven't already heard, I'm the contact person over the holidays as well. My team some members of my team take a little break, and I'm the backup. So I love my family, and I never mind if I need to make a quick phone call for work things too, as we all do, right? Family's good in doses. So yeah, I'm so glad all of you were here today. It's just been so fun. It's a privilege to be doing this work with you all. You all are amazing, and I am so grateful to those of you that I know, those of you I hope I get to know this year. I was, as I mentioned, I started our company 5 years ago, and someone was talking to me the other day who I've known that whole time, and they were like, Ginger, I remember when you were just making videos in front of your little fireplace at your house. And by the way, this is actually our office now. We have an office, and it's been an amazing group of people I've gotten to work with to get us here. Everyone's contributed so much, and it's a huge privilege to get to be a part of what you all do and help people. So thank you all for everything you do. I do have time for questions, and I know we covered a lot. I'm going to give people a chance in case you're still digesting, in case you want to ask a question. Was there anything else that anyone had questions about or that you wanted to bring up? You're also, of course, welcome to email or call me. I just want to check the chat. Did I miss anything? I think one thing I didn't mention that I would just throw in here at the end is, I know as we're talking about these new metrics, the CCBHC reporting, we're going to develop some additional reports beyond the quality measures for CCBHCs, because I don't know if any of you saw, the National Council put out a survey to CCBHCs where they asked a set of questions related to how much have your services expanded since you became a CCBHC, and are you serving more of these different populations? And we realized we could tell them, we could give you guys the ability to see that in your own data. So that's one of the things that'll be included when we start having people do CCBHC reporting in the new year, is a set of reports that helps you see, kind of based on those categories that the National Council defined, like where do you sit in relation to that? So we're going to be developing that as part of this project in Kansas, but it'll eventually be available to everybody we work with. So that's kind of one of the things I said. I sort of hinted at it when I called it like meaningful CCBHC reporting, but like when we think about CCBHCs, the idea is that they expand access to underserved populations. And there's different ways to define that, but we could know, like, are you serving more clients? Are you providing more services? Are you doing more mobile crisis services? Are you doing more services in the community? Like, those things are knowable from your data. So we just want to give you an easier way to see that so that you would know. Oh, yes. There's a question in the chat about our data model. Yeah, that was kind of what I was explaining, Rob. We are working on a data model that is like an easier way to do reporting. We've built that out like a lot over the last few months, and we're just starting to apply it more with our reporting. But yeah, that's kind of our goal over the next year, is to continue building that out. And in case it's helpful, what we're kind of referring to that right now is Janet certified tables. And we're trying to we're being really thoughtful about how we build that out so that it's scalable and so that it's not the kind of thing where it breaks. Those are our two goals, to make sure we build something that is scalable and stable. So that is what we're working on. But yes, that's basically what we're working on, so that everyone will have easier and more efficient access to the data that you need. Thank you for that question. Does anyone have any other questions? Okay, well, I appreciate you all being here. I also appreciate everything you're doing. I hope you all have a lovely holiday season and a great new year. I look forward to seeing you at events in 2025. We will certainly be here, and I am excited for what the new year brings. So thanks you all for being here. Yeah, I look forward to talking to you all soon. All right, take care out there. Have a great season, and we'll be in touch soon. All right, everybody. Bye.